How to measure blood pressure. An overview of the equipment needed to measure blood pressure will be the blood pressure cuff and the stethoscope. To begin, make sure the patient has rested for at least 5 minutes. The patient will be seated, feet on the floor uncrossed, left arm preferably elevated at heart level, proper cuff size, and no caffeine at least 30 minutes prior to the test. First, look at the blood pressure cuff. It should have an artery mark. Make sure you align it with the patient's brachial artery. When you place it around the arm, you don't want it too loose or too tight. When you place the stethoscope belt on the patient's arm, don't place underneath the cuff, but below it. When you start to inflate, make sure you have the pressure valve closed, righty-tighty, lefty-loosey. Inflate the cuff to 180 or 200 millimeters of mercury. Once you reach, turn the valve a little to the left to release at a rate between 2 to 5 millimeters of mercury per second. Watch the nanometer and listen closely. The first heartbeat you will hear will be your systolic. The last sound you hear will be your diastolic. And when you measure, only do readings at even numbers.